Are we ready to? Excellent. So I want to thank you for being here, both online and in person. Just FYI, the people in person do get to ask any questions. So if you ever have a question and you want to be like, but what about this? And if you have a question that's completely off topic, you can literally ask anything if you are here in person. That is the special benefit that the in-person individuals get. So with that being said, I love everybody online, but we do give preferential treatment to the people who do show up. So tonight's talk is going to be TMJ, and what did we call it? Why your jaw hurts and what to do about it. So we were very original on that one. All right. So with that being said, please come with an open mind and an open heart. I'm going to be talking about stuff. It's pretty straightforward, pretty mechanistic, but there is some neurological components, and there is various ways to help you. Excuse me. Doing laser protocols and seminars, I actually learned something very interesting about the joint that actually changes a lot of what can be done and how we can actually help you fix that joint. So I'm going to give a little foreshadowing or pre-shadowing, whatever you want to call it. The joint actually reacts very similar to how scar tissue is, and that's really important to being able to fix it. So what we're going to look at first is the joint itself. Now, you guys are going to have to deal with my very specific artistic skills. So what we're showing right here is the temporal bone. If you don't know where that is, it's literally the side of your head. So when you open and close your jaw, you can feel it move. And that bone, part of your skull, is called the temporal bone. Then you have what's called your mandible. And if you're like, well, what's a mandible? That's your jawbone. So your mandible is your jawbone. And then within it, and most people aren't aware of this. I drew that too big. There's actually a disc. And the disc is where the bone will actually sit between the temporal bone and the jaw. So when we look at TMJ or TMD or TMDD, these are all the same thing. If you go, well, what is this? This is talar or temporal mandibular joint, temporal mandibular disorder, temporal mandibular disorder dysfunction. I got the last one wrong, but it's the same thing. So talar mandibular joint or temporal mandibular joint is basically just telling you the skull and the jaw and where they meet. So when somebody says, I have a TMJ, I go, that's nice. I have one too. So I have a temporal mandibular joint here, and I have a temporal mandibular joint there, but it doesn't tell us anything. So when somebody says, yeah, I have a TMJ issue, they're just telling you this joint is inflamed. It's swollen, it's inflamed. Now, it can happen for various reasons. So what can happen here is that these ligaments can actually get lax or move. So we're just going to draw it like this, real simple, and then the jaw is like this. And what can happen is the disc can move so it's stuck in front, or the disc can move that it's stuck behind, or the disc can move that it's stuck on the side. And it shouldn't do any of that. It should be right there and be a cushion. And if it doesn't, it causes problems because the disc itself is what's supposed to stop the bone from touching the bone. So Yeah, we're talking about lockjaw as one of the symptoms. So did you know that you can get arthritis in your jaw? So any joint can get arthritis. So that means this joint, if the disc moves, then the bone can start hitting the bone, and then you can actually get arthritis in there and get inflammation. So that means every time you chew, it hurts. Every time you talk, it hurts. That would not be fun, would it? That would not be fun at all. So what we want to have happen, what were you saying? No, it'd really suck. You definitely lose weight because you wouldn't want to eat anything. You wouldn't want to chew anything. So what we want to see happen is the joint be right in a line. So what are things that can happen? What are different issues that this can show up as? So if you have TMJ dysfunction or tailormandibular disorder, tailormandibular disorder, then we can have pain, clicking, lockjaw, lack of movement. We can have jaw discomfort. And then this is where it gets interesting and it changes. You can have ear pain from it. You can have face pain from it. You can have neck pain from it. You can have pain behind your eye from it. You can have dizziness from it. You can have numbness and tingling into your hands from it. You can have shoulder pain from it. You can have vertigo from it. You can have visual issues from it. So you can also get chronic fatigue from it. So you can get all these issues that you would not think would come from your jaw from it. And what happens is it's compensation. So let's say you have that joint and it's locked up and your body's trying to fix it. These little muscles on the side of your neck called your scalenes and your SCM, which are these muscles here, they'll actually start spasming to try to pull the joint out, but it's not going to do anything. So the problem is when these muscles get tight, there's nerves that come through it from the neck that go to your hand. So when they go to your hand, those nerves can get pinched, and now you can get numbness and tingling in your hand and pain in the front of your shoulder, the back of your shoulder, the side of your shoulder, the back of your head, side of your head, all into here. So what are the areas that can be affected with the TMJ? Like, what are we looking at? We're mainly looking at the brainstem, the cerebellum. Those are the main areas, as well as we can do motor cortex. So we're looking at how are these areas actually moving correctly? How are they taking care of everything? So what are the things that are going to drive you to have jaw problems? Any ideas? Eating rocks, definitely, that could do it. Getting punched in the face, yes. A car accident can do it. Whiplash can do it. Head injuries can do it. Teeth grinding can do it, but teeth grinding comes from a bigger issue that I'm going to get into. So teeth grinding is a chronic problem that we see in North America, and it's literally a stress response. So have we ever heard of, I think it was World War II. Did you know that during World War II, they would give gum to all the GIs to deal with stress? So if you're really stressed out, what is one thing that people do to calm themselves down? They eat food. That's a stress habit, right? They're calming down that way. That's because when you chew, you actually stimulate the vagus nerve. So if you are somebody who has a hard time calming down, you can have a form of ADD called alpha ADD, which means that you speak to try to calm down your brain, and you're trying to stimulate your vagus nerve to do it. So if you don't remember, the vagus nerve is the great winding nerve, and it comes off the brainstem, and it goes down, and it literally activates the heart, the lungs, the liver, the kidneys, the large intestine, the small intestine, the gallbladder, the blood vessels. It literally controls all of these things. And if that nerve fatigues, then we know we have bigger issues. So how in this office do we check to see if the vagus nerve is working? Do you guys know? If you don't know, it's okay. Just say yes or no. No? Okay. So Have we ever done the test where I took that tongue depressor and stuck it on your tongue and then put it on the back of your throat? And when I stick it on the tongue, if you don't gag, it means your vagus nerve is weak. It means it's fatiguing, which means you've dealt with chronic stress in your life. Or you've had some crazy, weird trauma, which probably not that. Probably not been hit in the neck or anything crazy. So when we test that, we know the vagus nerve isn't working correctly. And the vagus nerve is the brake. It's the slow down everything, calm down. So what are things that can literally trigger the body to go into fight or flight response? We talk about this all the time. The 3 T's. Do you guys remember? So oxygen is a good thing. We need that to work correctly. But what are the 3 kinds of stress that we can have? Physical. So we can have physical stress. That's right. Falls, trips, bacterial, viral infections, hitting our head on something, different things like that. Then we can have chemical stress. Being exposed to smoke, eating foods that are high in inflammatory products for us, like gluten or dairy, or corn for some people, or soy for other people. If you're allergic to a food, like we have patients who are allergic to things like watermelons or cantaloupes. And it's funny because the things they're allergic to, they actually crave. I'm thinking it's because they get a mild dopamine rush when they eat them, because the body needs to push out an adrenaline to get the immune system start to roll. And then we have emotional stress. So if we have emotional stress, that can drive it as well. So back to teeth grinding, if we can't relax, our body is smart. It has an innate or inborn intelligence in it. So what is it going to do? It's going to try to stimulate the relaxation nerve, which is the vagus nerve. One way to do it is through deep belly breathing. So if you aren't aware of this, during COVID, to make sure that the vagus nerve actually worked correctly, when people are really sick, they actually put them on their stomachs, because that would force them to belly breathe. So literally laying on your stomach forces people to belly breathe, and then it would stimulate the diaphragm, which would make the vagus nerve get turned on, and their body would actually heal. So belly breathing does it, but if you're really stressed, you'll actually become a teeth grinder, because doing this movement will actually stimulate your vagus nerve. When they're sleeping, they're doing it because they're so stressed they can't relax. So their body doesn't want them to wake back up because they need sleep. So literally they're grinding their teeth because they're so stressed. And if we mechanically look at it, they say, well, let's put your bite guard in there so you don't break down your teeth. But there's a higher issue going on. The emotional chemical stress they have in their life, they can't deal with. And this is why the grinding's happening. So if you have a friend who's a teeth grinder, it means they can't deal with their life. That's literally what they're telling you. If they're not teeth grinding, if they don't wake up, their jaws are relaxed when they wake up, we know they're okay. But if they're teeth grinding, it means they can't actually deal with the stress of their life, and that's what's happening. I've had patients who have broken multiple crowns. We had one lady who broke 4 crowns a year because of her jaw. She was really emotionally stressed out. So that's one of the things that we look at, is how is that actually functioning? So when we look at the jaw for people, for it to be working correctly, you should be able to do this one simple thing. If you can do this, it means your jaw moves correctly. If you can't, it tells me we have a disc issue. The disc issue I'm looking for here is when the discs move forward. So you should be able to take at least 3 fingers, if not 4, and put them in your mouth straight up and down. If you can't do this, it tells me we actually have a jaw issue. So 4 fingers. Can we do it? We can? Awesome. We can't. It tells me the disc has gone forward and it stops the rotation of the jaw. We don't usually see bilateral or both-sided disc issues. What we usually see is an offset, where one of the discs goes forward and the other disc goes back, and that's that person when they open, they go down to the side, and we'll see it go down to the side. Other ones, if their discs are stuck backwards, they can't actually close their jaw. So then when you're looking at somebody, we want to see how is their range of motion. Can they go forward, backwards, side to side? How wide can they open and close? So this is going to tell me, where's the disc gone? How is it functioning? Is there an issue? Now, this is the most important part that you need to know about the jaw. This, when I learned this, it blew me away. Did you know the jaw joint is a fibrous joint? What that means, it's made of scar tissue, and it's one of the only joints that can regrow itself. That means the disc can regrow itself. People with chronic TMJ issues, guess what they get done? Discectomy. That means they actually take the disc out, and now they're literally going towards arthritis. That means that disc right there is removed. They literally cut it out, and now the muscles, if you're clenched, will literally drive that bone into the other bone, and you're going to grow arthritis. No, you shouldn't have it removed. If it can regrow, we want to regrow it. So why isn't it regrowing correctly? That's based on how stressed you are and how the joint is moving. So you see people, if they smile, and they smile slightly off, you know, if their jaw moves sideways when they're talking, and you can see it because you look at the little indent, and then the middle, is it going up and down? Or is it sliding? And so there are different ways for me to help you. If we want to make the jaw move correctly, we have to do a physical adjustment. When we do this, it's not just me adjusting the joint. I need to actually reset all the muscles around the joint. So there are multiple ways I can do this. I can do this by using my hands and doing a release technique of the muscles around the joint. We can also use laser to do this. The laser will put energy in and make the muscle actually contract and relax correctly. So if the jaw muscles are moving correctly, then I find out what is the pathway that it's moving. Is it forward and backwards? That's 99% of what we see, which is I got to push the forward ones back and pull the backwards forward. So you'll see me push on one and pull on the other side. And that can actually move the discs back to normal. If we have a chronic jaw issue, we can also have it where they're both forwards or both backwards, or the ones that I see sometimes is actually when it's lateral. So through the jaw, or it's off, or it's indented on one side and pushed out on the other, and you'll see a bump on one side to the other. So when you open and close your mouth, does it open equally on both sides, or does it not? So you want to feel over your jaw, is it moving equally or not? And that lets us know where we want to start looking at it. So first we need to release the muscles. We can do that through manually touching, using an activator, or using the laser. And the laser, what we need to do, if we do that, we need to actually reset the cerebellum. So we're going to laser the cerebellum, the brain, and then the nerves that come out, the brainstem, and then you actually go after the jaw. So the cranial nerves that go after the jaw are cranial nerve 5, cranial nerve 6, cranial nerve 11 and 10, if I remember correctly. And what that means is nerves coming off the brainstem. So right down low, that's what that means. That means your jaw is controlled majority by the nerves that come from the brainstem, not from the neck. So you want to look at those things. Now, what would happen, and we see this a lot too, if we do this all day? That can actually change how your skull sits, which can literally cause jaw pain as well. So if your head rotates too far forward or rotates sideways, it's literally going to make your jaw move differently. And most people aren't aware of this. How your body knows where it's in space It's actually your jaw movement, and how they sit is a relay to your body of where it is in space. So this is why you can know where you are and talk even though your eyes are closed. Your body actually sets the teeth and the jaw and how it moves to tell us. So if your head is sideways now, what's going to happen? You're going to want to straighten yourself up, and that's all because your head's off, because you're looking like this or like that, or you have some different issues. So we want to make sure our head is on straight. We want to make sure the first bone in our neck, second bone in our skull are all improperly aligned. Then we want to actually adjust the jawbone itself, called the mandible. And it's a very easy adjustment to do. We either adjust it forward and backwards, backwards and backwards, or sideways. Because if it's going sideways, and this is one that we can chronically see, we want to adjust that back in place. Then after we've adjusted it, we want to make sure it sets there correctly. So what is the thing that's going to cause it to not work correctly is chronic inflammation and how the muscles are moving. So what are the products that we use to make sure that the inflammation is under control so that we don't keep making a problem in there and making the fibrous joint decay? We're going to use different anti-inflammatory products. This is like omega-3s, fish oil. This is things like turmeric. So turmeric is an anti-inflammatory product, and it will turn off the cytokine storm. If you don't know what that means, it just means the white blood cell reaction that happens when your body needs to attack something or get rid of something. So that's when inflammation will turn on. You also want to use resveratrol. Resveratrol is the active ingredient in grapes that makes you live longer. So if you've heard, if you drink wine, you'll live longer, it's actually resveratrol. Not the alcohol, but the resveratrol that makes you live longer. Resveratrol, I'll have Brooke look that up. I think it's resveratrol. It's a product that we carry it's liquid and it's highly absorbable, so it helps with the inflammation. Then after omega-3s, resveratrol, and turmeric, you can also go after blood flow. So we can use a product called nitric balance. It is a vasodilator that will push blood flow into the brain, into that area, so that it will heal quicker. Then to also compensate with that, we want to push up neurotransmitters that make it so you're not as pain sensitive. So we can push up serotonin and dopamine. And we can use a product called Serotonin Active and Dopatone Active to help push these up. Serotonin and dopamine are both pain modulating or pain management supplements. So pain management as well as anti-inflammatory. Now, once the inflammation is gone, we don't usually need to do anything because the joint can rebuild itself. It's made out of scar tissue. Then we don't want to remove it or resect it, because if we do that, we're just going to get bone on bone and it's not going to get any better. Make sense? Then after we adjust it, and we're using the products, I also recommend lasering. Why laser works really good is it can actually drive energy and turn on the anti-inflammatory cascade. So basically what laser does is, let's say you hurt your ankle and it takes 3 days for all the inflammation to move through the cycle of inflammation. When you laser it, you can get it done in 6 hours. So it's not that it makes the inflammation go away, it makes it heal quicker. So it supercharges the inflammatory response so that it moves quicker and goes through it, so it doesn't sit there. Because if the inflammation gets stuck on, that's when we get problems. When that happens is when the cells don't have enough energy to remove the toxins. And that's when an inflammatory cascade can get stuck on. The resveratrol and the turmeric will break that cascade or that feedback loop so that it won't keep driving it. The other aspect that we want to look at is when we laser you, we'll actually laser the joint and we'll laser all the muscles around it and the brainstem and the nerves that come out to control it so that you have optimal energy going there. So we got joint moving correctly, muscles firing correctly, joints in the neck all aligned correctly, as well as lasering the joint itself to make the inflammation go down and healing speed up, as well as let the tissue heal quicker. So we use a multi-prong approach to help it work correctly. The other aspect that you want to look at is there any underlying things driving this? Does this person have eye movement disorders? Does this person have a tongue disorder? Which would tell me we have a brainstem inflammation issue. If we have those things showing up, we'd also recommend nose laser to make the inflammation go away from the brainstem. So you can see, you can take a multifaceted approach instead of just put this splint on and hopefully it gets better. That's usually what you get. Or people will literally get their teeth rearranged and changed.
No microphone.
Can you hear me? Yeah. Say that again.
Okay, what type of grapes? Concord grapes is best?
Oh, we're talking about resveratrol.
Yeah.
So the question is, for resveratrol, the darker the color, the better. How about now? Oh, I think my microphone died. I think it died. We're at the end.
We can hear you now.
Hopefully this works. I think the microphone's dying. Okay, so the time. So thank you guys. The microphone just died. Sorry about that. If a friend or family member, thank you guys. Have a good night.